Dr. Beth Kasanoff-Piper, president of the Dallas County Medical Society. Many of my patients are calling wanting to know when they can get a booster shot for their COVID vaccine. And some people are asking me, well, what changed? I thought the shots were working. So the short answer is that the shots are working. The COVID vaccines are working extremely well to prevent severe cases of COVID, hospitalization, and death from COVID-19. Far more than 90% of hospitalized patients are unvaccinated. This is a really great track record for a vaccine. But we know that some people who have problems with their immune system did not respond as well as the average person to the COVID vaccines. Plus, their underlying immunocompromising condition may put them more at risk for complications if they get sick with COVID. These people include organ transplant recipients, patients with active cancer undergoing chemotherapy, people who have certain problems making antibodies, and people who are taking high doses of steroids or other medicines to suppress their immune system. For those patients, the scientific evidence shows that they should get a third COVID mRNA booster shot at least 28 days after they finish the two-shot series. The additional shot should boost their body's own response to the virus, raising their antibody levels and provide them better protection. Those shots are available now for people who need them and who qualify. For people who aren't in that category of being immunocompromised, there are some new studies that have come out recently suggesting that the protection against infection with mild to moderate COVID illness may decline a bit over time. Much of this corresponds with the emergence of the Delta variant, but that's probably not the only factor. Relaxation of masking and distancing behaviors probably also contributes to the number of mild breakthrough cases that we're seeing. It's important to note that these studies did not show a decline in protection against severe COVID with hospitalization. But we would like to see fewer cases overall to help prevent transmission to the unvaccinated and prevent the development of new variants. The plan as described by the Surgeon General will be to give a booster shot at 8 months after the second dose was given. Before this can begin, though, the FDA and the CDC's Committee on Vaccines will need to do an independent review of the data and make their recommendations. This is expected to happen in the next month, so that booster shots could be available for people in September. It will be important to get the same vaccine you got the first time, since studies giving different vaccines from different manufacturers haven't been completed yet. And the vaccine you'll receive is exactly the same vaccine that you've got before. It does not have any different material in it. So where did this 8-month time frame come from? Because the risk for mild to moderate breakthrough infections seems to increase starting around 6 months, the 8-month mark seems to be a good time to give a booster to minimize the number of cases. What about a booster if you got the single-dose Johnson & Johnson vaccine? The data isn't available yet to answer that question. The Johnson & Johnson vaccine was administered starting in March, so there hasn't been enough time yet to evaluate for a decline in effectiveness. Experts do not recommend getting one of the mRNA vaccines as a booster if you receive the Johnson & Johnson vaccine. It's best to wait for the science to guide us. If you're immunocompromised, talk to your doctor about getting a booster shot now. If you have not yet been vaccinated, please go get your shot. And for everybody, wear your masks and avoid crowds to further decrease the risk of infection. That's what we can do right now to decrease our risk.